Hello everybody, I'm Camila from Brazil and I will present the work entitled Assessment of Pregnant Knowledge about Urinary Incontinence, Observational Study. There are no conflicts of interest. The gestational period is a moment in female reproductive life marked by transformations. Hormonal and mechanical changes in the maternal organism, essential for the development of pregnancy, can favor the appearance of pelvic floor disorders. And among the pelvic floor disorders, the urinary incontinence can be highlighted, being defined by the ICS as the involuntary loss of urine in an amount. Despite the high prevalence during pregnancy, and high costs and impact in quality of life, the presence of urinary incontinence during pregnancy is a risk factor for its future chronicity. Seeking professional care is still low. Women during prenatal care are not receiving information about UI or strategies to prevent or treat it. So this study aimed to assess the knowledge of pregnant women about urinary incontinence to encourage the development of specific interventions for this population. This study was an observational study involving 237 pregnant women. The data collection took place from May to November 2019, using an electronic form containing two instruments. One instrument for the assessment of social-demographic and obstetric data, and a validated scale for evaluate knowledge, attitude, and practice about urinary incontinence. The knowledge subscale used in this work consists of 10 items that assess women's knowledge about urinary incontinence, symptoms, risk factors, severity, and ways to prevent and treat. The data were analyzed using SPSS, and the project was approved by the Research Ethics Committee. The sample, 237 women, consisted of women aged between 18 and 33 years, the majority being married or in a stable relationship, with complete high school, premipperals, mainly vaginally. Between 237 participants, 36 reported never have heard about this condition. The majority recognize that urinary incontinence is more prevalent in the female population. However, a large part considered urine loss during pregnancy to be normal. Of all 10 items evaluated, the lowest percentages of correct answers detected were in relation to knowledge of risk factors, with the question, do you know what can cause the loss of pee? Prevention, with the question, what forms of avoiding UI do you know about? And treatment, with the question, what forms of treating UI do you know about? More than half that didn't know how to mention any risk factors for the occurrence of UI. Among those who mentioned one, pregnancy, childbirth, instrumental delivery was the most mentioned. Only 10 pregnant women recognized the weakness of a pelvic floor muscle, lack of preparation in the perineum as a risk factor. Most believe that there are ways to avoid and treat UI. However, more than half did not know how to mention any form of prevention or treatment. Performing pelvic floor exercises and surgery were the most frequent responses to prevent and treat UI respectively. So we know there is a big gap in the knowledge of the pregnant women about UI. Considering the loss of urine normal during pregnancy and inadequate knowledge about ways to prevent and/or treat it can make difficult for these women to report their complaints to health professionals. Establishing educational programs, both collective and individual, in prenatal care is a crucial step to improve the levels of knowledge about UI. Our concluding message is assessing the knowledge of pregnant women about UI allowed for a better understanding of the theme, being the initial step for the construction of interventions directed to the needs of them. Thank you.